We are continuing to follow healthcare access in this province as we welcome in the Minister of Health, Jeremy Cockrill, this morning from North Battleford. Good morning. Thanks for doing this.
Absolutely. Good to be here, Daryl.
Got a lot to get to. Let's talk about rural healthcare stabilization. This is a big talking point last couple of weeks for the NDP. What have you done to ensure that emergency rooms have doctors when people need it?
Absolutely. So, in terms of physician coverage, we've obviously been employing the virtual physician program right across the province to help with disruptions. This is really a very successful program designed by physicians. And, really important to note, that what's happening here with virtual care is we are really becoming a leader, I think, across the province in how virtual care is employed in our province and really able to serve the residents of the province. On the allied workforce side, so that's your nurses, lab techs, so on, imaging techs, we just added 77 new and enhanced full-time positions in communities right across the province. And really the focus here is to say, hey, which facilities are we having disruptions in? Where can we add full-time positions? And we're doing this because we've actually just saved $10 million of administrative costs out of the Saskatchewan Health Authority by doing a deeper dive there and finding opportunities for savings so that we can invest that right back in the front line.
Yeah, you touched on it there, the virtual health hub. It's going to expand, as you say, healthcare in the province, but what about those people who really just want to see a person face-to-face and have that interaction?
Absolutely. Our priority, Daryl, and you and I have talked about this in previous conversations. We want to make sure that there is a primary care provider in communities all across the province and that everybody in this province is attached to a primary care provider by 2028. We're making good progress on that with some of the work that we're doing with nurse practitioners as well as in terms of providing more physician training opportunities in rural Saskatchewan. But we really think that over time, more and more people are going to want to have at least a virtual option. Maybe that's not their primary option, but at least have a virtual option. Maybe they, it's more convenient for them. And maybe they just prefer that type of interaction. So we want to make sure that those types of platforms are available here in our province.
Are these primarily being rolled out in northern regions that are harder to attract healthcare practitioners to? Or are we talking about a wide scale? You could see them in Saskatoon, Prince Albert, Regina.
Yeah, so right now our virtual physician program is being rolled out in smaller communities where we may not have physician coverage every single day in emergency rooms. That's really important to keep those local facilities open and operational so that people don't need to drive hours and hours into the city to receive acute care. The virtual health hub, which I was at an announcement of on Friday in Saskatoon, the virtual health hub led by Dr. Mendez is really serving remote northern communities and, really some good work happening there in terms of providing especially better imaging access and diagnostic access for people in the north to understand what issues they might be dealing with so that when they do arrive in a larger tertiary care center, whether that be Saskatoon, Prince Albert, Meadow Lake, North Battleford, we know what they're coming in with and we can better serve those patients. You
said you found some savings at SHA to the tune of, I believe you just said $10 million. How have you been able to do that and where will that money go?
Credit to the Saskatchewan Health Authority executive team, specifically the CEO, Andrew Will. Him and I have been working closely together over the last several months saying, listen, we want to take more resources. Our province invests a significant amount of money in healthcare, over $8 billion, but we want to make sure that that investment is being used well. Those are our those are our tax dollars, right, Daryl? So what we've been able to do is take positions where there might be duplication, there might be some, smaller spans of control, adjust that a little bit and invest that right back into 45 new management positions that are on the front line, actually in facilities, not at a desk, but right in facilities. And then 77 new nursing positions, diagnostic positions, and lab positions in 30 communities right across the province. This is the whole thing. My priority with the Saskatchewan Health Authority is let's make sure that we're using our resources well. And if that means redirecting administrative dollars to the front line, that's something that I'm supportive of. And I think many people in this province would be as well.
All right, Jeremy, thank you for your time this morning.
Absolutely. Thanks, Darrell.